instead of on health care. And that's not to say insurance is a bad thing, but when it comes to health care, most of us don't think we ought to spend a lot of time gambling with our health care. And most of us don't think we ought to be gambling with our children's health care. My son he finished up with community college, came off my my employer-paid insurance when he went to AmeriCorps. Then he needs to come back onto my insurance as he goes on to continue his university. And I had to go through several rounds of paperwork just to satisfy the insurance company that he was a full-time student in university. The worry, the concern, what happens if something happens to my son while I'm taking care of this paperwork? And then I've got in 2 years, he's a year and a half now, hopefully, he'll finish up with university. Maybe he'll go on to grad school, but when he finishes up, what happens then? Is he going to make enough? Is he going to get an employer? I'm worried. Those are very real concerns, and I challenge any parent that really cares about their child to think about that. Mm-hmm. And any parent that might have that coming up, think about that. None of us really want to be gambling with our health care.
So what should we do? What changes should we make in healthcare besides trying to eliminate the gambling portion? What are some of the things that we should do that help control the cost? Because I think cost is what drives most of this conversation. Right. It's not that anybody doesn't have access to healthcare; it's the cost of the healthcare. People can walk into any hospital or doctor. The problem is you got to pay for it.
Well, I want to go back to an example. I spent 4 years at the Air Force Academy and then a bit over 9 years in the active Air Force. During that time, I didn't worry about health care. If I had a problem, I went to the clinic. Mm-hmm. No matter what base I was on, I went to the clinic. But that was in America. It's the same kind of thing that until the 90s, when the Reagan Revolution really took effect and all the outsourcing started happening, it was the same thing that dependents got. It was the same thing that most Congress people get. And that kind of ability to go to a clinic and get your basic health care taken care of without having to worry about your insurance card or not having an insurance card, that kind of basic health service is the model that I think is most effective at delivering health care.
So like the VA system, essentially, is what you're saying, similar to the VA system?
Yes, similar to the VA system for veterans, but more like the military model.
Okay.
And the rural health. We've got the College of Medicine there in Rockford, and they're incentivizing a lot of people to get their education and help fund some of that education if they'll commit to serve in rural areas. Well, committing to serve in rural areas, there's not the money there. General practice, it's not the money there.
Okay.
So we need to get past that and at least get some of the basic health care in clinics that people can go to. And we do that. We know that's the right thing to do. You look at a lot of communities, and what have they set up? I know my parents who live in western North Carolina, in Hendersonville, they're part of a free clinic system. And they've been supporting it. My father works in the free dental clinic, provides services for those in need. In general, most people will recognize that people deserve some basic level of health care. And we go so far as to do it through charity, somewhat inconsistently from community to community.
So we have, for example, the Whiteside County Clinic that's just right about a mile away from here, 2 miles away from here. How would that change under what you're proposing?
What I'm proposing would be an expansion of the public health service.
So you would just say that there would be more Whiteside County health clinics around then?
Yes.
And so someone like myself who has private insurance, I would go to the public health center like everyone else would.
You would have the freedom to go to the public health center like everybody else could.
But I still could keep my insurance and do a private doctor if I so wish.
Yes.
And then how do you, for example, you mentioned in Rockford about they're trying to incentivize people to go into rural, but the money's not there. How would you get those people that don't want to go now to go when the public system is put in place?
When you look at the kind of thing that the Public Health Service does now, the kind of thing that the military does with all of their healthcare providers, or at least did before we started contracting so much of it. What the military has done is they pay for people to get their education. Just like my education was paid for, thank you very much, by all of you taxpayers, but I owed you 5 years of service after I received my education. And I did that service, and I got some more education and paid some more back with more time service. In the same way, the public health system would be supported by, instead of creating this system of huge student loan debt that then has to be countered by highly paid doctors to counter that, they get their education paid for and they owe their service, and then they can either continue in the public health service or go private.
So instead of a person going in and taking out debts to go to medical school, the government would pay medical school, and then their obligation would be to serve for so many years afterwards, and then the government tells them where they're going to serve.
Right, which is just like the military. They pay generally for some education, basic training at least. You serve your country. But think about it, what are in our personal interests? Healthcare is very personal. And isn't that something that we should be defending, our healthcare, our health, just like we defend our nation in other ways? And doesn't that warrant a service similar to the military service?
Okay. All right, my next question is actually about energy dependence or independence. We live in a fairly rich, abundant state. We've got coal, we've got oil reserves, we've got natural gas, we've got nuclear, we've got wind farms, we've got biodiesel, we've got, ethanol. What are your thoughts on helping reduce our dependence on foreign countries with our energy?
Well, a lot of what we need to do is really a two-pronged effort. One, we need to look at resources that are renewable. And that takes a lot of forms, and could take a lot of forms that we may not even be aware of. There's the obvious wind, solar, geothermal, even some bio-type things like the switchgrass, possibly even corn or ethanol, ideally without threatening the food supply. So there are all those renewable sources, and we need to look at those, but we also need to look at the second prong, which is smarter use of energy. Some of that, though it sounds like we're depriving ourselves, is to reduce our energy usage. But there are ways to reduce our energy usage through efficiency that we haven't taken advantage of. And we need to look at the smart grid, the idea of, with all of this IT, with all of this technology that we've got available, why don't we have things shutting down, even in our homes when we're not using them? Why don't we have more focus on battery systems that are storing energy and taking off-peak energy? And that way we don't have to create as much capacity to generate peak energy.
So do you think that that's a government responsibility to do, or is that the market's responsibility, or whose responsibility is that?
It's a combination of responsibilities.
Okay.
Today, we have spent most of our history, we have in some way shaped our market in America through government rules, regulations, tariffs, taxes, that kind of thing. We have, for a number of years, incentivized tobacco sales. More recently, we have de-incentivized tobacco sales. We've done the same at times with alcohol. We've encouraged, like I know in Iowa, I just got finished driving through Iowa, and you still see the price of ethanol-based gas is lower than fuel without ethanol. So from an Iowa perspective, they're incentivizing the use of corn. They grow a lot of corn in Iowa. So that kind of market shaping is the kind of thing that the federal government needs to do. But in that market shaping, we need to do it in a way that's not focused on just what we know